Hi, welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Usha Rajagopal, and we're talking about a bunch of different topics. We're also going to be posting the doctor's phone number in a minute, so get ready to write that down. Dr. Usha, let's talk about lasers and fillers, because I know we were talking about tightening of the skin. So I'm interested in that because a lot of people don't know that you can actually tighten maybe the facial skin, neck skin. Tell me about that.
So there are a couple of different ways to think about skin tightening. Okay. One is just skin resurfacing. That means lasers that you apply on top.
Okay.
They'll help with wrinkles. They'll help with fine lines.
Okay.
And that's the Fraxel laser, the CO2 laser. Okay. And those have been in the market for a while now.
All right.
The second way to think about it is tightening from the bottom up, from the inside on top. And I'm particularly thinking about Ulthera. Ulthera is a focused ultrasound, so it generates heat, and it heats up the deeper layers of the skin, so it improves the collagen production. So you actually get lift and tightening, especially of the jawline and the neck area. And it's also used for the décolleté area, where you can get like the fine crisscross between in the cleavage, and it tightens all that.
The women have such problems with the neck area and cleavage area.
Yes.
It's usually red because, you know, of sun damage. And then it's just lined. That can help with that?
It can.
That's fantastic. And of course the neck. A lot of women will do something to their face, leave their neck out.
Yes.
But that's not good.
There's no harmony between the face and neck, so you really want both to be down, yes.
All right, so if somebody wants to tighten up their face, their neck, maybe do a little décolleté, how do you say that?
Yes.
I said it wrong. What's the timeline on that? How long does that take?
So with the Ulthera, it's again an office procedure, and it's minimal downtime. You can have some swelling, and rarely you can have some bruising, but most people are back at work right away. And it takes about 90 days to notice full results.
And do you have to do more than once? Do you have to come back, or does it take care of it?
It's usually a one-time treatment. Again, if you have very severe problems with the neck, a lot of sagging skin, then you actually need surgery.
Yes.
But if things are starting to go the wrong way, then Ulthera helps.
Oh, that's wonderful. And can you get rid of maybe some sun damage on your chest area?
You can get rid of some of the sun damage on your chest area too.
Do you combine lasers and fillers? Is there anything you do where, you know, how do you do that?
So a great combination would be Ulthera along with a filler called Sculptra. That's a stimulatory filler. That means you inject it in, and it takes a couple of months to start working.
Oh, okay.
Or you can do Ulthera and Voluma, or Ulthera and Juvederm, or Ulthera and Radia. So they're actually they go really well together, and they work synergistically. So they make both things work better and last longer.
You're talking about Voluma, so let's take a look at some pictures.
Okay.
First one. What's going on?
So if you look at her, especially the cheek area and the smile line area, you see how everything is lifted up? There's less shadow. So with Voluma, what I like is she still looks very natural, but she looks rejuvenated, looks more vital, but doesn't look like she's had anything done.
Not at all. So you just filled in the parts that were a little hollow?
Yes. So it's basically the cheek. In both sides, and it lifts up.
Oh,
so when you inject the cheek, it actually lifts up the smile lines.
All right, so how long did that take?
Something like that would take about a 30 to 40 minute office visit.
And any anesthesia on that one, or?
Just topical anesthesia. Okay. We put some numbing cream, and that's it.
That's fantastic. Oh, this looks good.
So here, again, it's on the cheeks. So
what do you need maybe just to kind of get that lift?
About 2 syringes of Voluma.
Okay, and one time, does Voluma stay, how long does Voluma last?
So I usually tell my patients it'll last a year before you need a touch-up.
That's good.
But if you look at the FDA data, the FDA says it lasts 2 years. But really, if you wait 2 years, it's all gone. So usually you should come back in a year for a touch-up.
Come back for some little touch-up. And look, you didn't even fill those lines. They just lifted right on up.
They lifted up. Because the skin is thin enough, it lifts it up.
Do you need a ride on these?
No, you don't.
Okay, good. So you can go get them done in the office. And look at this.
Same thing, especially if you look at that, that oblique view, you can see how everything looks lifted. She looks like herself, but she just looks a little better. Yeah,
just definitely less tired, and you don't see those shadows as much anymore.
You don't see the shadows, and she looks better, and she doesn't look like she's had anything done.
Not at all.
There's no telltale sign of having anything done.
A lot of people are overdoing the cheek area right now.
That's very true.
Seems to be in.
So you need to look at the whole face and really have the entire face blend together. So you just can't have the very full cheeks like you see in some of the reality TV shows and ignore the chin or the jaw.
No, not at all.
All the areas need to be done
Then it looks lopsided.
It looks very lopsided. Same thing. And then there's a picture that shows the cheek in the side view.
Oh, yeah.
So that's called the OG, or the gentle curve.
Okay.
It gives you that curve because as you get older, that cheek flattens.
The curve, yeah. But then you've got to do it, just perfectly, so you don't get the over. curve?
Exactly.
Or, I mean, that's, that's done
so
really
you
well.
would do voluma to the upper cheeks and another sort of filler, if they need, to the lower part of the cheek. So using like a Juvederm or something around the chin area or a Radiesse works really well.
And so cost-wise, and you don't, I know you don't really want to say the cost, but does it vary? Is there a range?
Yeah, usually voluma costs a little bit more than Juvederm or Restylane, but also lasts a little bit
longer. That's the key. Last photo here.
Again, her, you can see, so it's in all races. Everyone looks better. You don't need to be one kind of skin type or one kind of facial feature, but everything looks good. We do so many fillers that our costs are very competitive.
Oh,
very,
good.
Very competitive, yes.
Okay, good. That's good to know. And you didn't do anything with the eyebrows there? It's just all...
It's all fillers.
Just cheek. That's fantastic. I like that. It looks really good because, you know, just very natural and not tired anymore. All right, great stuff. All right, for more information about Dr. Rajagopal, you can call 415-392-3333 or check out her website, and they can see all the pictures there, right?
Yes.
All right, sfcosmeticsurgery.com. We'll be right back with Bob.